Okay, welcome to my channel once again. Today is about clinical pharmacology. So yesterday I talked about amlodipine, which is an antihypertensive medication that we use to lower high blood pressure. And initially I have mentioned some medications that when you combine them together, you're going to bring down high blood pressure to normal. So, and I listed them. They are amlodipine is number 1, which I've already treated. Number 2 is valsartan and hydrochlorothiazide. And number 3 is clopidogrel. So for today, we are going to be looking at valsartan and hydrochlorothiazide. So let me just clean off these amlodipine so that we'll have a space. And clopidogrel. All right. So let's go straight to the point. We are talking about valsartan and we're talking about hydrochlorothiazide. So valsartan is a drug or a medication that you use to lower blood pressure. It belongs to a group or a class called angiotensin 2 receptor blocker. That means they block angiotensin 2. Do you get it? They block angiotensin 2. That is the class it belongs to, or you call it the group it belongs to. Now, if you are an anatomy student, a nurse, or whatever, let us go back to angiotensinogen that we are taught in school. Now, what is angiotensinogen? Angiotensinogen is a protein that plays key role in RAS. RAS means renal angiotensin aldosterone system. So angiotensinogen is produced by the liver. So here is the liver. It's produced by the liver. And then when it is produced by the liver, it flows from the liver into the bloodstream. Here is the bloodstream moving, right? It flows into the bloodstream. Now, in the kidney, when the kidney begin to experience or notice low blood pressure or low blood volume, the kidney is going to respond to this by releasing renin. I want to call it renin or renin, releasing renin. Now, this renin travels from the kidney into the bloodstream. Now, what this renin is going to do is that it's going to attack this angiotensinogen that was released by the liver. And then the renin will convert angiotensinogen into angiotensin 1, which is this, converted into angiotensin 1. Now, as they are still moving in this bloodstream, they will go around the lungs. In the lungs, an enzyme called ACE, angiotensin converting enzyme, will further convert angiotensinogen 1 into angiotensinogen 2, which is the main active form of angiotensinogen, where it acts on the blood vessels and begin to constrict these blood vessels. That is what angiotensinogen is coming to do. Now, what valsartan now is coming to do, look at valsartan here going down. What valsartan is coming to do now is to prevent angiotensinogen 2. So what valsartan is going to do is simply to prevent this angiotensin 2 from constricting the blood vessels. Do you get? So that is what you do. So it's going to help the blood vessels to relax. This is simply the mechanism of action. Now, I told you earlier that we'll be talking about both hydrochlorothiazide. So let's go back to what hydrochlorothiazide is going to do. Hydrochlorothiazide, as the blood vessels are relaxed, there are some things that flows into the blood vessel. So hydrochlorothiazide is going to begin to remove something like calcium, excess water from this blood vessel that are flowing. You remember amlodipine that we talked about earlier is going to block the influx of calcium. So calcium will not be entering, because influx of calcium is going to lead to constriction of the blood vessels. So even though something like that is in existence, what hydrochlorothiazide is going to do is actually to begin to remove the already existing excess calcium and fluid that are inside the blood vessels, so that with time it's going to regulate the blood pressure. Okay, let's go straight. We've talked about the class or group where Vasatan belongs to, so we are taking it right. We've talked about the mechanism of action, what Vasatan is going to do, so we are going to take it right. Now, the rest thing we are going to talk about is going to be the indication. What is it for? So since we are targeting high blood pressure, we want to bring it down. We say hypertension. That's our main indication for today. Then what are the side effects? Now, since this drug is going to go through the mouth, you're going to see something like dizziness, lightheadedness, and then you're going to see hypotension. So it needs closer monitoring. Now, what are the contraindications? Please and please and please, what you should understand here is very simple. In this contraindication, please don't give this medication to a pregnant woman, especially people in their second and the third trimester. Please, if not, it's going to kill the baby. Don't do that. Look for other alternative. So what we are having here is pregnancy. Let me use another color so that it will be just, we have pregnancy. We have hypersensitivity reaction, that is allergy. We have allergy. So let's just drop it on these two. Now, the next thing we're going to consider here now is the roots. The roots of this medication, the root and the dosage. So what is the root? We are going for oral. And the dosage, I'm not going to give you a prescription, please. So I'm just going to give you a general knowledge. It comes by 40 milligram, 80 milligram, and 60 milligram, and 320 milligram. Okay, I hope we are following. All right, let's move down to the next option. Talk about the nurse's responsibilities. As a nurse, if you want to start administering this medication to your patient, please, the first thing you should do is to check their blood pressure. Remember, you're trying to bring down blood pressure to normal. So it is not if they are having hypertension, you start giving them Vasatan to kill them. So check blood pressure before you commence treatment. Then the next thing is you monitor potassium serum or serum potassium. The next one is you monitor for hypotension. After, you must have observed the rules of drug administration, the right dose, the right whatever. So the next thing we're going to be talking about now is drug interaction. You know one thing about all these medications, sometimes when you take it, there's always drugs that you should not take both of them together. For instance, we have ACE, angiotensin converting enzyme inhibitor, like something like lisinopril, captopril. Please don't take this drug together with them. Or you have something like potassium sparing diuretics like spironolactone. Please, you don't have to co-administer this drug together with them. It is very, very important. So this is all we have for Vasatan. So for the other one, which is hydrochlorothiazide, please, I want you to go into it and read about it by yourself. The next class we are going to be having is clopidogrel. Thank you very much. Please subscribe to my channel, watch, follow, recommend my channels to people, because pharmacology is